And good morning, everyone. Happy Monday to you. Hope that you are starting off your week with a good roll. It is spring break for many folks out there, so I hope you have a very enjoyable time this week and get to spend some time with your kids. We are going to get started on this thing in just a moment. Going to do our 30-second countdown, and then away we will go. If you're looking for the kickstart, you found it. Get ready for some breaking news. It is Monday, March the 11th. We have got a lot of stuff to share with you today. Glad that you could be with us. Hope that the information we bring you weekly is useful to you. You know, this is a very complicated industry. The healthcare industry is a lot going on there. I do want to be clear about something though. When we talk about healthcare here, we really are talking about healthcare in most cases. While we do talk about health insurance some, be sure and understand healthcare and health insurance are two totally different things. And while a lot of times they intersect in various different ways, they are very different. And so we want to be sure that you understand that there is a difference between those two things. All right, we are going to get started now with some of the big stories. Also, don't forget that at any time you can go ahead and make any comments or any questions you have. You can put that in the chat and we will address those once we are done with the different stories we're going to go through today. So don't hesitate. We are here to help. That is all part of what's going on here. We want to make sure that you understand what is going on in this crazy industry that we know and love. Like I don't know, maybe we don't even like it, but we are here to help you. So here we go. All right, the first thing that I want to bring up today is a very interesting rule that takes effect today. And that is the way that it is determined if a worker is an independent contractor or if they are eligible and for benefits, in other words, classified as employee, have changed. This is a very, very big deal. This new rule really restricts who can be considered an independent contractor. If you know of one of your clients or one of your soon to be clients or one of your potential clients that this rule could have an effect on, now is the time to speak to them about what's going on. There are a number of good resources out there, but I can tell you the big part of this is going to be how this is determined, because they're using a very different way of looking at it than what they have looked at it since Trump made some changes to the rule to begin with. I'll tell you, I was really surprised when you go down and read through some of the ways that someone can now be considered basically a W-2 employee, a real employee. There's a lot there that you need to digest. We literally could have a whole show just about that. So I want to bring this to your attention so you can go out there and find out about it. But it's a new rule from the Department of Labor, okay, that is restricting who can be considered an independent contractor. This can have very widespread effect across multiple different industries. Those of you in this insurance and financial services industry, you know very well that most people are considered independent contractors. And so when you go through and you look at how this rule can affect even our industry, you're going to be extremely surprised at the way that it's lined out. Once again, I don't want to get too deep in the weeds in this, but you certainly need to take a look at it. One of the things that I will talk about real quick is, and so there's 6 economic reality factors. Okay, so I'm going to go over these real quick. The rules 6 economic reality factors are: is there an opportunity for profit or loss, depending on their managerial skill? Is investments by worker and potential, is there investments by the worker and the potential employer? Okay. Is the degree of permanence What is the degree of permanence? Is it a permanent job, or is it actually a gig, or is it a contract job? What's the nature and degree of control that the individual has? If you don't have much control, that you've got to go through a set schedule, then that's going to lean them much more towards the employee. The extent to which the work performed is an integral part of the potential employer's business. How important are they to your business? Once again, are they doing gig work? Are they doing fundamental parts of your business that you couldn't do without? That's an employee. Historically, that is a job for an employee, not a gig worker. And then the worker's skill and initiative. Do they have control over that? Are you hiring someone with a specific skill, or is it more wide ranged? I think that this is going to affect a lot of folks. So make sure you take a look at that and determine if it's something that is going to have an impact on you. All right, next. Very interesting. We keep talking about PBMs, right? It's in the news all the time. PBMs just are hovering over us like this death cloud, as it were. And one of the things that has happened here recently, we talked about it last week, is that it looks like Congress is not going to make any kind of changes now. It'll probably be even after the election. So we're talking about, November later before anything is even looked at again. And I thought one of the interesting things that was pointed out was that a senator had asked the FTC, hey, what's going on with this? Didn't we actually put something out, some orders that were issued to give some data? What's going on with that? Well, yeah, those orders were actually put out in June of 2022. They were reminded, the PBMs were reminded once again in May and June of 2023. Now, the head of the chairman of the FTC, Lina Khan, has put in a letter. It's just mind blowing, folks, that to date, no company has turned over sufficient documents and data to be in full compliance with those orders. They're just ignoring it. That's the bottom line. The fact that the government hasn't done anything in this round to change what's going on with PBMs, it just coincides right with this. This has been out there. So here we are. The order was done back in June of 2022. No one's complied with it. And more or less, that's just the way it is. So, as I have mentioned previously, do not keep waiting for the government to make changes to something that they're just not going to do. There's options out there now. There's good quality, solid options out there now that you can save your company tons and tons of money. You can save your clients tons and tons of money if you're a benefits advisor out there. So stop using the big three and some of the ones that are right behind them that are not going to comply, and they're not going to follow the rules, and they're not going to be transparent. They're not going to be fiduciary. But what those words even mean anymore, because it's been so lost in this crazy industry. But there are some good guys out there. And certainly, if you want to know who some of those are, we have worked with them, we have sat down with them, then please reach out to me, and I'll be happy to share the information with some of those good guys as well. All right. So what is next? Employer and marketplace plans getting negative ratings. Well, I wanted to really be very specific on this, because not everything in here, this whole Kaiser Family Foundation report was all negative. There was a lot of negative there, but there was a piece of it that I felt was very important for you to understand, because this is something we run into all the time. We've heard the term. If you haven't heard it before, we were taught this term here within the last couple of years by different folks as the continued pushing off onto the patient of cost are there, and that's copay poor. Well, what is copay poor? It means that, yeah, maybe I have copays for my plan, but the daggone things are so high now that I can't even afford the copay on my plan. But this particular study, this piece of this study showed that large shares of adults with employer group coverage and marketplace coverage really rate their insurance companies very negatively when it comes to premiums and out-of-pocket cost. So these are the big things people are getting ate up by with these plans these days. And so the amount they have to pay out of pocket to see a doctor, folks would have that rated it fair or poor. 50% of folks that are on employer plans rated that out of pocket to see a doctor as fair to poor, so below average. 55% of marketplace people that are on marketplace plan, 55% said it's not. It's a negative experience to have to pay for that. It's too high. Okay, the amount they have to pay actually for their insurance, 46% of employer plans said they have to pay too much. 55%, once again, of marketplace. Now, the interesting thing to me on the marketplace there is that, right, the tax credits are supposed to keep that low. In many cases, what I have seen is that it doesn't take a whole lot of change to all of a sudden make that marketplace plan to be extremely expensive. And so people are finding that as well. And then how much money people have to have to pay out of pocket to fill a prescription. It really is not as bad on that. It's 35% on employer plans and 43% on marketplace plans. But to compare those numbers, as we're looking in 50s and 40s kind of across the board there, for your Medicare plans, you're down in the 20% for people that are dissatisfied. And for Medicaid, you're in the 10s for people who are dissatisfied. So there's clearly a line drawn into marketplace plans and employer plans where people are unhappy with their out of pocket and in their premiums in many cases. So I thought that was a very interesting study, especially when we know that there are plans out there now, there's plan designs out there now that can actually absolutely eliminate those out of pocket costs. So now, you're zero to go to the doctor and you're zero to have certain services done, including even surgeries, if you follow through your medical utilization management. So there's a lot of innovative things out there that can really take a big chunk of this unhappiness with an employer plan and put it elsewhere. The marketplace, I don't know what to tell you. The marketplace is marketplace. I think these numbers are going to get worse before they ever get better because there's nothing that happens here except for higher out of pocket every single year. That's what we're seeing. I mean, this year, crazy out of pocket or deductible can be as high as $9,450. No wonder people are dissatisfied. All right, next, healthcare takeovers. So it's been very interesting few years for private equity in healthcare. They spent about $1 billion in takeovers in the last 10 years. But what has happened in many cases is they buy a practice or they buy a hospital or whatever it looks like. They strip it down, sell it again to make some profit. But that place then struggles afterwards. There's story after story of this happening. Well, for whatever reason, now all of a sudden, the government has decided that they're going to take they're really going to look at it. So the feds are finally looking into private equity ownership in healthcare. I'm not saying it's too late. It certainly is not too late. But obviously, the folks in private equity they have a whole different story to tell about what their impact has been. But I do believe that there is been a little bit overuse of private equity. I know a number of things that have been purchased that certainly have not been the same. A number of doctors groups that certainly have not been the same after being purchased by private equity. So there's the good and the bad, right? I mean, they're investors, and that's what they'll tell you they are. They're investors. They see a market that is prime for being invested in, prime place to make money, and they've done a very good job of making money. But once again, my opinion is that they have had a very negative impact on healthcare and the access of healthcare just because of the way that their practices are not in support of patients, they're in support of profits. So it goes right along with hospitals, your big insurance companies, and private equity. They're all after the same thing, profits, not taking care of folks. And whenever you go down that pathway, this is what you're going to get. However, that's allegedly what the government now is looking at and deciding that they're going to look at some of that. That's Department of Justice, the FTC, and Health and Human Services are all looking at private equity, investigating to see if there's wrongdoing and possibly even changing the way that they are able to access those things, the way that they're able to take those over. So we'll see what happens. That's a fairly new thing that's happened here. So we'll kind of keep track of that for you and let you know as things develop. All right. So last week we talked, of course, about the Change Healthcare data breach. That is still a thing. Not surprising. It is still a thing. However, CMS has jumped in and is assisting some providers that are struggling financially during this time. It's actually been called by the American Medical Association the most significant and consequential incident of its kind against the U.S. healthcare system in history. Wow, that's a lot of words, right? I'm not saying it's wrong. There has been obviously a huge bit of disruption that has happened to the healthcare industry because of what has gone on to this particular data breach, ransomware, whatever you want to call it here. But there are a number of things that CMS is doing. They're assisting providers with switching clearinghouses if that is what needs to be done. They have issued guidance towards Medicare Advantage and Part D providers that encourage them to relax prior authorization requirements. If you didn't realize that, that is one of the things that has been impacted is getting verification of benefits and also being able to switch the data back and forth to get prior authorizations. They're also recommending that the same for both Medicaid and CHIPS providers. So there's a lot of things going on with this, a lot of moving pieces. There is the promise from United Healthcare, Change, Optum, all that big conglomerate, that the 15th, which is Friday of this week, that the physician portal will be back open for putting in claims and getting then payment. So we'll see what's going on at this time. You're either using a separate clearinghouse or folks are having to go through and do paper, which we talked about last week. Big difference. You're talking about a 33-day payment cycle if you submit electronically and a 93-day payment cycle if it's on paper and it's all submitted correctly the first time. Obviously, when you submit paper, there's a greater chance for an error and it to be kicked back. So a lot going on there. We'll keep you up to date as it goes on. Now, this is a pretty big story right here. I say this for last because this is brand new. This just happened on Friday. Wegovy has been approved for cardiovascular indications. So Wegovy the only real use, that's not true, obviously, but the only thing it had been approved for prior to this was just weight loss therapy. And therefore, in most cases, it was not on formularies. It was not approved on any type of group plan or even an individual plan. But this is a big game changer, huge game changer, because if it is now approved for cardiovascular and it has shown that it is the 5-year trial has shown that it is reduced major adverse cardiovascular events by 20% and even had an impact on heart failure related symptoms, then now all of a sudden there is there's a way to kind of shoe in and get Wegovy on the formularies or to get employers to start covering it. Another GLP-1 that could have a devastating effect on a plan if it is not regulated in a proper way. If it's not implemented into your health plan in a way that makes sense. There's a number of folks out there working on various different ways to bring these in and not keep them away from people that it should be given to, but make sure that they are the person they should be given to. So this is very important because just like all of the other ones, they could have a huge impact on the plan itself, on the plans. Now, I'm not saying that the folks aren't worth that, but once again, we know that a number of people are taking this simply because of the weight loss, not because they should be taking it for this. This is just another door opener. So wanted everyone to know, once again, just happened on Friday. This is hot off the presses, as it were. And it could be something that you start seeing come across that plans, hey, folks want this because of their cardio risk. So keep this in mind. Once again, you got any questions about it, be happy to answer. Reach out to me on LinkedIn, reach out to me on Facebook, wherever you may be listening to us, and we can talk about it. All right. So now it is time. Excuse me. Now it is time for any Q&A or any questions that may have come over on the chat. So we will give you just a second to put any of that comment in there. And if my producer's got anything that's come across already, you can please put that up, and I'll be happy to address any questions that anyone may have had, or read off any comments anyone may have had this morning. Get a quick sip of coffee here, folks. All right. All right, gang. Well, if we do not have any comments today, we are going to go ahead and cut off, let you get into your week and in your spring break. Hope everyone has an extremely blessed week. Don't forget, you can reach out to us in multiple different ways. Go out to our website, www.eaglecare.com. You can find us on LinkedIn. You can find us on the, we do have a few. Hold on. Okay, so one of the questions is something that I had answered already. How will GLP? Okay, all right. So this is how will GLPs affect employers? GLP will affect employers once again because the cost of them is extremely high, and I mean we're talking about with Wegovy somewhere around $1,200 to $1,300 a month for that, and if you can imagine a few employees on that. It could have a pretty devastating effect on the overall spend, especially if you have a number of folks that are looking for a way to get into that and they really want it now for that weight loss. So there can be a lot of cost involved in any of these medications. Once again, we're not saying you shouldn't give it to folks that really need it, but there's got to be a way to determine if that is the medication they really need when there are other options out there as well. It's a tightrope, right? We're walking a tightrope with some of these medications. And so we just want to make sure that the folks getting it are the folks that really need it. All right. Thanks again for being here. Appreciate everyone out there listening. If you got any questions, reach out to us. Be happy to help. Everyone have a blessed week. We are out of here.